Good evening, everyone, and welcome to Community Grand Rounds this evening. My name is Dr. Dorian Miller. I'm the director of the Center for Community Health and Vitality, and on behalf of the Institute for Translational Medicine and the Urban Health Initiative I'd like to welcome you to our discussion for this evening. We're going to be covering the following topic for this evening: memory loss, caregiving, and navigating resources during a pandemic. As most of you know, we've been in the midst of a worldwide epidemic of the COVID-19 virus, now into our third year, and that many of the challenges that our communities are facing have been multiple. Not only have they been challenges around losses, people getting sick, and losses in many respects in terms of work, in terms of loss of loved ones, but also being able to take care of our day-to-day responsibilities, particularly at a time in which there's been a disruption in day-to-day activities, has been especially challenging, and particularly for people who are either have caregiving responsibilities or may have memory loss themselves. And so we're absolutely delighted to bring you this session today. We also partner regularly with the Southside Healthy Aging Resources Network and would like to thank them for the contributions that they've made to the work that we've done around bringing topics that are of concern to older adults to this format in the past. In addition, we'd also like to thank our community consultants who work with us on this program, which represent a number of community-based organizations on the south side of Chicago. We thank our medical students from the Pritzker School of Medicine who helped to support us with information and outreach for this. And also one of our speakers who is part of our Community Champions program in our graduate medical education, who's going to be speaking today, but also the support of our Community Champions. And so without further ado, I'd like to introduce our first speaker for today. Her name is Dr. Wendy Chen, and she's a fellow in the area of geriatrics, which is a study of the issues of aging and physicians who take care of older adults. And she's going to give us some information about what is memory loss or dementia and why does it happen. Dr. Chen, thank you so much for joining us this evening.
Thank you for having me. It's a great question, and I think it's something that we should definitely define. I'm going to share a few slides because I'm a visual person. And so for those of us who are visual, I think the first thing to define is, what is dementia? Quick check, everybody can see my slides? Okay, great. Because it's a little bit more than just where did I put my keys, right? Dementia is a general term for a loss of memory, language, problem solving, and other thinking abilities that are severe enough to affect daily life. And then beyond that, there's different types of dementia. When we usually talk about dementia, it's often interchangeable to Alzheimer's disease because that's the most common type of dementia. But there's actually many others, including a mixed dementia where you can have multiple ones of them. So as shown here, Alzheimer's is a pretty big chunk of our dementia. There's also Lewy body dementia, there's vascular dementia, as well as frontal temporal, and then a lot of the others that are actually kind of small and looking at kind of the percentage of dementias. And then, like I said, you can have more than one of them. Just a quick talk about, well, what is Alzheimer's then? So Alzheimer's is kind of changes within the brain that affects learning, memory, organization, recognition of familiar things, and then finally kind of the deterioration of language. Okay, so we're gonna stop this. And just a quick reminder that it's not normal aging, right? And then kind of that second part is, well, why do we get it? Unfortunately, We don't know. We don't really know why some people get dementia and other people don't. We do know that there's risk factors, meaning that people have a highly likelihood of getting dementia. The biggest risk factor is age. So for people, say between 65 and 69, there's around 2 people for every 100 people in that age group that have dementia. And then people's risk then increases with age, roughly doubling about every 5 years. So that means those over age 90, there's 33 people for every 100 people that actually have dementia. Other risk factors include cardiovascular disease, untreated high blood pressure, untreated diabetes, high cholesterol, smoking and alcohol use, untreated sleep apnea, head trauma. And we also know that it affects different races disproportionately. We have recently had a study that showed that African Americans tend to be affected even twice more than their counterparts, looking at different medical conditions. So if you stack them up with the same medical conditions, they were twice as likely to kind of have that. And the interesting thing is that genetics actually doesn't have that high of an impact, less than 7% associated with inherited genetics, and that generally impacts people at a younger onset of age. So they start getting dementia at 40 and 50 years old. All right. So that was kind of our about memory. I guess the other question that we can answer is, well, what can we do about it? And so some things that we can do is address all those risk factors that I just talked about, right? Eating healthy, exercising regularly, getting good sleep, maintaining a healthy weight, controlling that blood pressure and blood sugars, stopping smoking, drinking responsibly, and a reminder what drinking is, right? The recommended guidelines are 1 drink for ladies and 2 drinks for men. That's defined as like a single beer or only 5 ounces of wine each night. And treating hearing problems and seeing problems, as well as treating mental health problems. All right. So I will stop sharing here. There you go. Thank you for the opportunity.
Great. Thank you so much for those comments, Dr. Chen. I think that it's always very helpful to provide information so that we have basically a level of understanding of what things are and what things aren't. I know oftentimes in the community and people are joking around and talking about Alzheimer's disease. They go, oh, you've just got Alzheimer's disease, don't worry about it. But that comparison chart that you showed about what is normal aging versus what are some of the symptoms of Alzheimer's disease or dementia, I think is very important. So thank you so much. Please stay on the call because we probably will have some questions for you a little bit later on today.
Certainly.
Thanks. Our next speaker is Tessa Garcia McEwen. She's a licensed clinical social worker and also a certified dementia practitioner. She works for the Memory Center at the University of Chicago Medicine, which is in our Department of Neurology. And Tessa's going to talk a little bit about your role in helping those with memory loss and navigating resources. And also she'll talk briefly about dementia-friendly Hyde Park. For those of you who had the opportunity to listen to the Community Health Focus Hour, Tessa was one of our guests on there and was able to share information and resources with our radio listeners. Tessa, are you ready?
Yes.
Great, thank you.
Yes, I'm going to share my screen as well. One moment. Okay, so hi everyone. I'm so happy to be here. I work for the Memory Center, and I'm, having worked with thousands of patients by now for over the last 6 years. We are, as a medical team, really as an interdisciplinary group, find a way to get to the heart of the diagnosis for the memory loss and also treatment, but with also a sense of their living environment and how do we navigate the challenges throughout the journey from diagnosis and beyond. And so I want to leave with you some resources that are not only how to help when you're isolated, especially needing more virtual and at-home support, especially through the pandemic, but also now that the pandemic is lifting, the resources that are coming back, right? And so the big picture idea here is when it comes to memory loss and dementia care, we really want to pay attention to the personality of someone who has dementia and lead with dignity and enhance their quality of lives. It's including your own, right? I look at the big picture, we look at the caregiver and the patient, and let's all look out for one another in the community and beyond. And so there are 5 priorities I really want you to come away with. So lead with dignity, prepare early, consider safety and communication, learn as much as you can. I'm going to give you jam-packed resources here. That's why I have some slides for visual aid. And really keep an eye out in the community for those who look a little bit lost or confused. And it's very fearful. So we want to help each other feel safe. And we want to help one another who are caregiving to really build in some rest, support, and recreation. And so really just to kind of give a little bit of a primer too, anything that you can come away with from tonight, I really want you to imagine memory loss like a bookcase where we have a full bookcase if we are have a healthy brain, but the top of the bookcase is where our first things about decision-making, cooking, cleaning, driving, paying bills, facts, short-term memory, that's the first thing to go. But look at the very bottom. This is where we have hope. At the very bottom is where our emotions lie. This is where we feel hurt, angry, stressed, scared, or embarrassed, but we also feel love and connection. And you can imagine it feels very unsettling and scary to be in the body of someone who has memory loss because of the missing books on the top shelf here, but we can feel in our hearts. And so everything is interpreted by how it comes off. So till our last breath, this is what I learned on my first day. No matter our level of cognitive impairment, we will all be able to detect frustration and impatience in one another. And we are hyper fluent in body language, words, and tone, right? Everything is processed by how it feels and how it comes off. So let's pay attention to our body language, our words and tone when we're talking to someone with memory loss, because that's where it's most sensitive. Just a quick example, in the clinic with me, I had a patient who literally said, and pointing to the top bookshelves, I don't know what I just said. I don't know what I just did. And then at the bottom bookshelf, he pointed, but I see you looking at me funny, right? So they really interpret how things come off and how things feel. And it's very frightening. So we need to create an environment that feels connected and safe and warm. And we also understand that you as a caregiver, care partner, might be very busy juggling many things all at once. You're helping to care for your own families, for the loved ones, doing all the chores at once. And so what do we do, right? We have to slow down and figure out how to get the resources we need while at the same time we're noticing these symptoms. And so how do we do that? We look at the symptoms that we're noticing, maybe the ones that Dr. Chen was describing, the forgetfulness, getting lost, missing appointments. And then I would recommend that you contact your local neurologist. So here in Chicago, for example, we have the Memory Center, and you can contact us. We have 2 sites where we have people for 65 and up and 64 and below at U Chicago Medicine. You can look that up on our website. But really, what the doctor does is he does a diagnostic workup with a physical exam, scans, a cognitive assessment, anything that gives us a sense of which dementia type we have. And then you're connected with an interdisciplinary team. It's really important to connect with folks all around you to pay attention to what those symptoms are and get medical treatment. And then you can get connected to the resources, right? For the care planning component. And that's where I come in. Share Network Chicago here is one that has a significant resource directory. And you want to look for opportunities to engage in social engagement. And we are going to cover all the topics as well. So one award-winning program that we have recently is called Art is In. And it won 2 national awards this year based on its innovation through the pandemic. It is welcoming participants even now. So any of you in the audience who like to participate, it is on thememorycenter.uchicago.edu/artisin. And it is a free 8-week program where you get professionally curated art at home kits to do projects and creative conversations with a person with memory loss. And we're celebrating 10 years this year. It used to be in person, but because of the pandemic and the actual vision of the program, it is at home and it's tech-free, Zoom-free. So I think that's part of why it won so many awards this year, is because it really tailored to the pandemic. And prior to the pandemic, we also partnered all together to do the first dementia-friendly Chicago River cruise, and we hope to resume that. And basically what we have done, and with the advent of the dementia-friendly Hyde Park initiative, we're the first in the city of Chicago to receive the dementia-friendly neighborhood designation. What we're doing in the community is we're doing staff trainings in the different sectors, like the medical sector, the business sector, libraries, stores. So keep an eye out for the dementia-friendly Hyde Park and throughout the state. If you're interested, we have opportunities for that as well. And at the end of the day, when it comes to finding care, you really need to spread out your resources. What I like to recommend is a spectrum of care from pro bono to private pay. The first stop is eldercare.gov. Eldercare.gov gives you the national site where your local area on aging gives you resources for things like in-home care, adult day services, pro bono respite where someone can come in for a few hours at a time for free. This is all for free, okay? And I always recommend that if you want to do adult day, you can get some hours for free, and then you can get some hours a la carte, private pay over time. And it's quite affordable to cover yourself. Now that the pandemic is lifting, adult day centers are opening up, and there's just a shout out. There's a brand new one coming in Englewood as well, so keep an eye out for that one. But I'm just wanting to share with you that so many families were so strapped with caregiving, and so we would use a lot of the Department on Aging state subsidized care. And I want you to notice too and speak up that there is an ADRD grant. It's called the Alzheimer's Disease and Related Dementias Grant. This offers additional benefits for those. So when you call your local area on aging through eldercare.gov, you can find this across the country. And I always encourage families to get help from their family and friends, right? There's pro bono support through that if you can, and you can organize yourself around lotsofhelpinghands.com or Sign Up Genius. Have people, drop off meals, have people pitch in. When I talk to whole families, I often have whole Zoom consults with adult children from all over the world where I say, hey, I understand each of you have different capacities and limitations, but the person needs help. So can you help with the cost of caregiving? Can you help by visiting every so often? Can you help with setting up, dropping off meals, right? So we need to spread our capacities around because it is an all hands on deck condition. And then find what your other benefits are. Usually those with a Medicare Advantage plan don't realize that they actually have reimbursement for private caregiving. And then if you're a veteran, you have cash assistance for that as well. If you need local contacts for any of the above, whether it's long-term care or caregiving or adult day, visit communityresourcefinder.org. That is an Alzheimer's Association resource that's vetted. A lot of what you'll have to figure out is help with medication. You know, so many families couldn't be in the home. So there are ways to do medication reminder systems virtually or that are electronic. And then for safety, you know, we're worried about wandering, and we need camera systems. I worked with many families who were working with their loved ones from afar. So they utilized resources from alstore.com, or they use the Theora Connect GPS watch, which offers automatic two-way communication, for example. So these types of things are important to keep in mind when we're working with safety measures for the families. And then oftentimes transportation is a challenge. I want everyone to know about the PACE Taxi Access Program if you're in Chicago. Anyone around the country, find your local taxi services and discount services. There are those available. The Taxi Access Program here in Chicago is $3 a ride up to 8 times a day, and it's worth a $30 ride. You know, there are a lot of things out there that we can coordinate for our families. And there's a lot of reduced cost attorney support as well. So in other words, when I'm coming across a family who has complicated family dynamics and there's issues of decisional capacity and guardianship, and what do? There are reduced cost attorney resources here, okay? And then when it comes to identifying your decision makers, you need to have a healthcare power of attorney, and your local state Department on Aging has their forms on their site at the ready, okay? And then in terms of virtual support, there have been many amazing resources out there. I wanna point out Mather's telephone topics, for example, on here, where there is monthly and daily virtual activities at the comfort of your home, almost like listening to the radio, with social engagement, history, culture, right? Music performances with Mather's telephone topics. The Memory Cafe directory gives you a local spot where you can have arts, music, and movement virtually from the comfort of your home. And ZinniaTV.com is a memory care TV, basically. It's hard to listen to the news, and oftentimes my patients will absorb what's on the news, and it really impacts them. But Zinnia TV has free videos that are tailored for those with memory loss, and utilize the resource directories that are around you all over the country and here locally in Chicago. So this is just another dive into what other resources are out there. Whatever the condition your family member has, or the person with dementia, look up their national association for that specific organization, for that specific diagnosis. For example, the AFTD is for the Association for Frontotemporal Degeneration, right? Or LBDA is Lewy Body Dementia Organization. So find what your local one is. And then if there's anything that you want to learn more about memory loss and communication strategies, I highly recommend TipaSnow.com and her YouTube channel. So there are many options out there for learning and research, but I'm just highlighting a few around so that you can get your feet wet. And if you want these slides available to you, we can ask as well. So feel free to be in touch with us about the Dementia Friendly Hyde Park. That's the link on the very bottom. Share Network Chicago is in the middle. And we are at the memoryscenter.uchicago.edu. But a lot of this is very relevant for those who are participating nationally too. So visit eldercare.gov and Memory Cafe directory, and you will get some resources for your local area. Thank you.
Tessa, thank you. That was terrific. You know, one of the ways that we measure how engaged people are on these Zoom calls is by looking at the chat. And there has been so much silent side conversation going on for people asking for resources, asking questions. Natalie Watson will make sure that she sends this information out to people who are here this evening, because we know that you're very anxious and interested in getting these resources for support. And so really appreciate your sharing these resources with our audience this evening. I'm going to turn my comments to Clarita Bingley, who also had the opportunity to share some of her experiences as a caregiver on our recent radio program on WVON. And she's going to share some of her wisdom and challenges of being a caregiver with us this evening. So Clarita, thank you so much for joining us this evening. And why don't you go ahead and get started?
Thank you for having me again. Like Tessa and Dr. Chin said, and I think at the last meeting we had, I said the best thing that you could do for a caregiver is give them your support. And at that time I was meaning like support in joining a group or meeting with people that know about these things so that you could learn what you were going through and know what you were experiencing and what you could do. I did not know when my mom got Alzheimer's, I did not know what was happening with her. And like I said before, she was my best friend and we did a lot of things together and discussed a lot of conversations together. So this was totally new to me. And I did join a group there at the University of Chicago Hospital, and they spoke about that. And I think I mentioned before that someone did say their story, which was so similar to mine that I just kind of busted up crying. But I said that to say that, you know, getting the support and knowing what's going on, that is so important. And I think this these group sessions that you all are having in this, I love them. I love them. But I'm gonna have to be honest about some things as being a caregiver. I didn't want anyone taking care of my mother other than me. So when someone offered to stay with her while I go out or take a break, I would always refuse. This is my mom. If someone wanted to sit with me, I love that. Or if they would come and talk with my friends, and I would we'd watch TV together or eat together. This was all well and good. I would tell stories and say, you wouldn't believe what mom just did, or what she said, or some of the things that were just so out of the box. And we would usually laugh, and I would laugh, and when I laughed, she laughed. So it was okay because, you know, I didn't, like I said, I didn't understand this Alzheimer's disease, but I did like that she was laughing. But there were some very hard things to do, like she used to get her hair cut at least once a month, and I had to take her to get her hair cut, and that was hard. So when a friend came over and helped me get her in the car and take her to get a haircut, something as simple as that helped a lot, a lot. I had her play with my dog. She loved doing that. I would cook at home and bring it over to her place, although my brother was an excellent cook, because at one time she did stay with me, and then at one time my brother had her. Near the end he had her, but I would go to work, and then after I left work I would go and stay with her until I went to work the next day. So, and I would read scriptures for her, because as she got worse and worse, she could no longer read either. Like I said, the most important thing you can do is listen to a caregiver. I had sleep problems, probably because I cried so much. I was mostly stressed. I was exhausted. This was very hard. And I was depressed and sad while taking care of my mom. I'm a Christian. I had my conversations with God, and believe me, they weren't always good. Just admitting. I was taught not to ask questions, but I did. I asked, why mom? Why this? Why that? And had those tantrums. Mom was 75 when she passed in her sleep. And she was diagnosed with Alzheimer's when she was 70 years old. So she had it for 5 years. I was a caregiver for almost 5 years. I was married, and after 11 years of marriage is when she was diagnosed with Alzheimer's, and I had 2 sons, ages 9 and 10, when she was diagnosed. She used a cane and then a wheelchair, and that was really hard when she got into the wheelchair, because that was when she couldn't walk at all. So this was very hard, traveling to go to doctor's appointments. I hear you saying now how they have PACE and these, but at that time they didn't have all these services available. So moving right along, this is just excellent. Some of the things that they are doing for memory loss patients now. I'm loving it. Wish I had it at that time. And she was also provided with a special bed, the kind that you can just push the button and it comes up and goes back. And sometimes she liked to play with that, so I had to hide it for her because she'd ride it like it was a toy. I think a lot of older people, and I am an older person, like to stay in their home when they get sick. They don't want to go to a rehab center. They don't want to go to a well-being center or whatever you might call it. So they they think of nursing home. Oh no, don't send me there. And that was my mom. She didn't either, But I think there are some good things going on now, and I think they give excellent care, much better than probably we could do. But I think some of them are a bit pricey, and this is what seniors worry about. But again, I'm hearing that they have good programs now for that not to worry seniors as much. For example, I won't mention the name of the place, but I looked at some of the charges for some of these things, and they were kind of astronomical. I mean, a studio 6,000 or private suite 5,000 or things like that. And some of it's probably covered under your Medicare or whatever. I don't know. I really don't know, but I hope I wouldn't have to pay that much. But I think if I get some of this information that's been talked about, I've been jotting it down, and I heard you all saying, I left my email address. I would like to receive all that information because it's information that we're talking about. It's good information. It's information that I didn't have when I was taking care of my mom, and I want to pass it on. I belong to a group at the Croc Salvation Army Center, and we discussed this quite a bit because we have older parents that are going through some of these changes, and we share our stories. And I think the best thing in the world is to share your story. So I appreciate you having me, and thank you very much.
Oh, Clarita, thank you so much for sharing your journey with us. And I think the couple of the takeaway lessons that I have for this, both here and also listening to you share your story on WVON, is that you really need to pay attention to what the caregiver desires in terms of their support. And it may not be the same for every person. Also remembering that, and Tessa brought this out too in her comments, that this is all hands on deck. It's team action. It's not one person, because there are some in having only one person that's available. I've been a physician now for over 30 years, and I've cared for people in which they're couples in which one person has dementia and the other one is the caregiver. And they said, the caregiver, no, I'm fine. I don't need anything. The caregiver gets sick and passes away, and it leaves the person with dementia still with us, and trying to figure out how to navigate that sometimes can be very, very challenging. So I thank you for that. And I think that your comments are actually a wonderful setup for our next speaker, who's going to be Dr. Cheryl Woodson. She is a caregiver. She is also a self-care expert and an author, as well as a physician. And she'd like to talk about how do you find balance while being a caregiver, and why is self-care so important? Dr. Woodson, thank you for joining us this evening.
Well, thank you for having me. And I just want to hug Miss Clarita virtually if I can. I took care of my mother for 10 years and diagnosed her myself. I had just finished my fellowship in geriatrics at UCLA, and I was director of the fellowship program at the University of Chicago when I realized that she just wasn't the woman who raised me. And what I found too is that all of that education means nothing if it's your mommy. The pain, that didn't help me with the pain. It only let me see her last days from her first day of diagnosis. And so I had living grief through all of that time. My children were 18 months old and 5. They had learning challenges and health challenges. I was also taking care of a mother-in-law who was dying of lung cancer while I was on the faculty of the University of Chicago. So balance was important for me. And I have 5 keys to caregiver survival in my book, To Survive Caregiving. And the 5th key is to do what flight attendants tell you to do on an airplane. Put your mask on first. You cannot take care of anyone if you're sick. And just like we just heard, I had a 58-year-old caregiver drop dead and leave 2 80-year-old people here. And she knew to the last pill when her parents' medications were going to run out, but she hadn't had her blood pressure taken in forever, didn't know her diabetes wasn't under control. So she thought that heart attack came out of nowhere, but it didn't actually. While we are taking care of the doctor's appointments and the house and the money and the car and the food and the medicines, we have to take care of the one thing that makes all of that possible, and that is the caregiver. So what helped me was, first of all, to realize that I wasn't alone and to make sure that I didn't isolate myself. Even in the pandemic, there are many of us who had phone conferences with friends once or twice a week. Even though we were all masked, we would walk out in the parking lot and talk to each other. We also did things to help each other. Like all of us would cook a larger portion of something, break up into smaller pieces, meet in somebody's parking lot and share, so everybody wasn't cooking every night. You know, we have to find ways to support each other, not just in caregiving, but in being more than caregivers. We played music for each other. We shared books that we were reading. I mean, the whole idea is to connect with other people and to indulge some of the other parts of your life that are separate from caregiving. And it brings up something that Ms. Clarita said very, very clearly. My 4th of 5 keys is, if you don't want to have to drive all the time, take your hands off the steering wheel. You have to let people help you. And even if they can't do what you want them to do, if they can't sit with someone or do personal care, can they get the oil in your car changed? Can they pick up your kids from basketball practice? I mean, whatever people can do, I think Tessa talked about this too. Whatever people can do to help you, you have to let people help and then value what they can do without micromanaging. I mean, do you care whether it's a blue shirt or the green shirt? Do you care whether it's tuna salad or chicken salad? You can't micromanage. You have to value the help that you can get and understand that you deserve it. If something happens to you, what is going to happen to the person you're trying to take care of? So if you can't do it for yourself, do it for them. Take care of their caregiver. And in small ways, take a bubble bath. Do your nails. Read something that you just want to read for fun. But the whole idea is to connect yourself to your life outside of caregiving. Whether it's a weekly Bible study or a weekly prayer group, or just sitting down and talking to your friends on the phone. What'd you cook last night? How do you fix this? Looking at other things that can be interesting and supportive of you, that'll help you grow as a person outside of being a caregiver. Caregiving is very, very difficult and very rewarding. I too, Miss Clarita, was very honored to take care of my mother. But I also understood that if I didn't take care of myself, my brother was out of town. He wasn't going to be able to take care of her. So I was able to go hiking in Vermont for a weekend in the fall because a cousin came to take care of her. And I allowed that to happen because when I came back from Vermont, I was a much better caregiver. And I'll be doing a series on the nursing home decision. And a lot of times people don't like using nursing homes because they feel that people go into the nursing home and pass very quickly. And they're worried about that. But sometimes I think it's that people use that facility too late. They've waited until the caregiver was so sick and so tired and maybe had not been giving the kind of care they wish they'd been giving because they didn't take good care of themselves. So I always tell people, if you don't want to have to use a nursing facility, you need to go to Aruba for a week, or find a way to do something that gives you joy just because you're valuable, not just because you're an excellent caregiver. You're valuable because you're breathing. You're valuable because you're on the planet. And if you don't take care of yourself, there is no way to continue to be a good caregiver. The second of my 5 keys is take the S off your chest, a step away from the kryptonite. You are not super caregiver. People try to do with 1 or 2 people what it takes 3 shifts of nurses to do in nursing facilities. You really need to pool your support and allow people to help you. It was very, very difficult for me because I started out as a long distance caregiver. And I brought my mother to stay with me and she set my kitchen on fire. And my 18-month-old daughter was in the hospital and I didn't have anybody to watch mother. So I took her to the hospital with me and she decided she was going to walk out on 53rd and Cottage and smoke. And she was the kind of person that opened her purse to anybody and handed money to anybody. And she could no longer communicate well enough to let somebody know where she was supposed to be. And I had to make a decision to choose between my mother and my child. And I went with my mother and sent her back to Philadelphia the next week because as a mother, I really couldn't do that. There was more family there. And we cobbled together between family and church members and paid caregivers until the crack addicts came into her North Philadelphia house, took all the food out of her house and my father's tools. And then I brought her back again and it was time for a nursing facility. But in the nursing facility, you are still the caregiver. You're still the caregiver. So you have a relationship with the staff. You are a citizen of that facility. I used to give in-services for their staff. My choir from church came. My praise dance troupe came. It's just like PTA when your kids were in school. You become a citizen of that facility so that when they see your name on the caller ID, they don't duck. You go to the care conferences, you raise your questions, you're still the caregiver. Letting somebody take care of them in your home doesn't mean you're not the caregiver. You have to be the quarterback. You're not running all the plays by yourself. You are the brains of this organization. I recently did a blog called the CEO of your caregiving company. You're CEO of your insurance company. Do you make the coffee? Do you do all the Xeroxing? No, you are organizing and making sure that everybody gets things done without having to do it yourself. So it's just really important for me to tell you that no matter how difficult it is, no matter how many caregiving responsibilities you have, you don't have to do it alone. And you need to let people help you. That support is out there. Thank you.
Dr. Woodson, thank you so much about that. And I'm seeing people that are applauding you around the Zoom room. And so really appreciate those comments. And I think that also thinking about that when you talk to doctors about this, that we are members of communities, we have families, and we're impacted about these things in so many ways. My grandmother lived with my mother and father for about 5 years before she went to a memory care facility. And it was very difficult to get my mother to even acknowledge that my grandmother was having challenges with dementia. I was living in another state at the time, and when I would come back to visit, I would say, Mom, something's wrong with grandma. She's wearing plaid and polka dots together and wearing the same outfit time after time whenever we see her. And it's just, I think you need to get her evaluated. And she ended up having a different type of dementia when we finally had her evaluated. But she started developing symptoms in her late 70s, passed when she was 93. But it was certainly something that was progressive over time. Home, being able to care for her at home, but also having adult day health available was the thing that actually allowed our family to have her in the home for as long as we were able to do so. Because my mother at the time was still working, I was living out of state. And even though my mother and father were tag teaming on this, it was just really very, very difficult in terms of her care. So again, Dr. Woodson put in her caregiver survival packet at drcherylwoodson.com. You can go to her website and find out more about it. But as I said, and very be able to care for yourself. Our anchor man and last speaker for this evening is Mr. Melvin Thompson. He has been a part of our Community Grand Rounds family for some time. He's the executive director of the Endoleo Institute, and he's going to talk a little bit about the work that he's done in community and specifically with the Carter G. Woodson Library and some of the dementia services that are available. And so, Melvin, so glad that you could join us this evening. If you could share some comments with our audience for the evening.
Yes, always a pleasure, Dr. Miller. You know, all you got to do is call me and I'm there for you. Love it. And I'm just flabbergasted to see all of my colleagues in one place at one time. I just need to, man, just a huge hug around this. Thank you all for this. And I've been taking incredible notes. 7 years into this, as an executive director of the Endoleo Institute, we are the nonprofit community development arm of Trinity United Church of Christ on the far south side. So I come from this work, I come at this work really from a spiritual perspective, and I've heard Clarita talk about those conversations with God, and so many things I've heard tonight resonate because in our community, in our culture, often God is the cure for our diseases, right? That I'm just gonna wait on Jesus, and those kind of things are. That's part of our faith walk, but we also have to have a discerning spirit as well, right? To understand, I can lift this table myself and take it across the room, but if I ask someone to help me, that load is a lot easier and a lot lighter. And so it's really, as a community-based organization, we're kind of the bridge to our community about this insidious, incurable disease that is just, if someone's on this Zoom for the first time today and this kind of platform, this has to feel overwhelming, because I'm overwhelmed and I've been working with it. But you talk about financial, you talk about self-care, resources. When we started this work, sometime in 2015, these kind of resources did not exist. In fact, I love when Dr. Chin talked about what can you do about it. Well, around that time in 2015, physicians were not telling loved ones that their loved ones were suffering from dementia. They kept that from them. It was more like, he's 80 or she's 80, it's senility and all of these things. And I asked some of my health partners at the time, why is that? And the simple answer was, because there's nothing you can really do about it. So instead of arming people with this information, it was literally kept from them, right? So you didn't know what they were going through. And so only now am I starting to see, I mean, it's like light years ahead of where we were in 2015. And maybe because now, you know, there are celebrities and well-known people that have started to, you know, come forward and all these things, because it's inevitable. You know, when I look at this audience, you know, today, I don't think I see an African-American male. And that's usually par for the course. Every time I'm in these rooms, these forums, these platforms, yet I know, I know, because I've got two other brothers that are caregivers for my mom. And I know we're out here, but we're not assembled, right? We're not at the table, and we're not getting these resources, in part because a lot of times we haven't bought into the fact that there's something physically or biologically or mentally wrong with our loved ones. Well, don't worry about Uncle Joe. He doesn't talk to anybody. Yeah, he repeats himself, but you know, there's nothing wrong with him. And that's our own stigma around mental health, and that there's nothing wrong with us. That, and if there's anyone that, you know, any culture that should be in therapy, it's us. One of the things I was really heartened to hear the other day on NPR was that there are more and more people starting to seek therapy, and maybe because the pandemic has really rendered itself, I mean, to some point, you know, it's almost, it's such a collective, that the way we've been impacted, that people are, you know, psychiatrists and therapists are seeing more and more people. And I mean, I know it's necessary because this is overwhelming. I'll never forget a colleague of mine who cared for her mom probably 12 years. And I attended her funeral, and she had her caregiver stand up to be acknowledged during the service, and 14 people stood up. And I saw that in the early stages of when my mom started to exhibit that kind of behavior. And I said, man, you need a team. I mean, you need a couple of basketball teams to do this work. And that's when I gained the respect for how powerful and overwhelming this is. And like Clarita, I didn't want nobody caring for my mama. No, we'll take care of it. Okay, now ask me about it today. Go ahead, go right ahead. Call me if you need me. If she gives you some problem, put me on the phone, I'll talk to her. But I mean, all through this journey, which is probably 7 years now, because we actually lost our dad during this process. Out of nowhere, he comes down with Lewy body dementia, right? And and I think Parkinson's accelerated. 2 years after his diagnosis, he's gone. So, my siblings and I probably haven't even grieved properly his death, because my mom's just took off, right? And now, we got practically 24-hour care for her. So imagine dealing with this professionally as a nonprofit executive director, and personally. And that might seem like unfair, but actually, in a backhanded way, it gave me the tools, the few resources and the tools that I needed to come home and share with my siblings what was going on, and why my mother and why my father are repeating themselves, and why they're calling us closing bank accounts every other day, right? And so, I mean, it was, I never forget, we do this work, and I should say this, we do this work at Andaleo, and we started in partnership with Northwestern Medicine back in 2015, when one of my staffers had to bring her mother in because she was suffering from Alzheimer's, and she cared for her until her death. And I remember that journey, and I remember, how absent my staffer had to be, because being there for her mother and, the things that her mother would get into. And I remember, upon her death, my staffer saying, Melvin, if there's anybody that has gone through what I've just gone through in 2 years, we've got to get out there and find out how we can get resources and help for these communities that are probably going silent. And that's when we reached out to Northwestern, and we've been, joined at the hip ever since. That's when we learned, from as Dr. Chin pointed out, this 2-to-1 ratio, right? 2-to-1 ratio in African Americans, and yet we don't know about it. We don't know about it. And so the complexity of the disease is one thing, but to not know about it is it's just completely unfair, right? And so we started a community development project. When I first came in as director, we wanted to fix our library, the regional library that Dr. Miller was talking about, excuse me. And I saw this as a project that would really galvanize the community, something significant, pretty simple, yet salient to the entire community because it's at the corner of 95th and Halsted. So we were successful in getting that done. It's a beautiful space, but what started as a community development project actually morphed into a health project because a colleague, Dr. Kareem Watson at UIC, came to me one day and said, Melvin, the work that you're doing with Northwestern at Woodson, think about if you made Woodson a health information hub where caregivers and professionals could coalesce around this issue. And it just blew me away. I talked to Northwestern, we went to the city thought it was just an amazing idea. And so we started programming, dementia-friendly programming at Woodson probably 5 or 6 years ago. We were actually calling it a dementia-friendly library, which was actually illegal. We weren't supposed to do that, but don't tell anybody. But now it's just a place that's a library where we have dementia-friendly materials. And we're going to be morphing into, Tessa, a dementia-friendly community in Washington Heights because we're copying off y'all, all right? We work with the Share Network and we're really excited about that. But just that whole idea of doing this programming and then bringing folks from Rush, Northwestern Medicine, U Chicago, the Alzheimer's Association, the American Heart Association, everybody at the table. So myself and a colleague, I think Darby is on the call tonight, Darby Mohart, Dr. Mohart, we became co-chairs of the Woodson Library Health Advisory Board. And so we have researchers and people from FQH, federally qualified health centers in the community, scientists, all at the table, caregivers, clergy, faith-based representatives, all around this table to talk about the myriad of things that are happening in this space. So maybe one month we're talking about health powers of attorney, right? And then the next month we're talking about finances and how to make sure that your loved ones aren't opening and closing. I never forget that. I mean, it's like, Mr. Thompson, this is PNC Bank and your dad just he's here and he's closing, and I'm like, okay. And I'll never forget being in one of our focus groups, because one of the things that came out of what we did is we start partnering with other African-American churches in the nearby neighborhood. So we had St. Sabina, we had a number of different churches, and all of them were saying the very same things. So we started these focus groups and, just, kind of caregiver support and all of those kind of things to be a resource. And then comes COVID to just blow all of that off the table, right? Just blow all of that off the table, because now the city and everyone else is saying, stay away from each other, no contact, which is the worst thing you can say to someone. And the whole idea of now staying away from someone that needs you 24/7, right? And so what a challenge that was, making sure caregivers were wearing the proper mask and, counting on them to be vaccinated around your parents. And I mean, it's a nightmare. And at the end of the day, that song, after you've done all you can, then you just stand. That's all you can do, because you're gonna be crazy. You're gonna be crazy. And so you have to rely, to Dr. Woodson's point, just get real with it. Take a trip, go. And sometimes even now, my younger sister, who I think is on the call, is the boss. Now, I don't know how she got to be the boss being the youngest, but she tells us what to do. And we do it. And, I often feel guilty because, man, the things that she goes through with my mom, it's overwhelming. And I'm always concerned because she's raising her family. I'm raising my family. We're in that sandwich generation, right? Where we're raising our own and we've got our loved ones to look after too. And out of a sense of duty, what else are we gonna do? That's what we do. That we just take that on. And I alluded earlier to African-American men, the pride, and we're not going to come crying on anybody's shoulder talking about what we're going through. We're just going to do it. And I was in a forum with AARP before, I think right at the outset of the pandemic, and they mentioned a term I had never heard, and it was called presenteeism. So everybody knows what absenteeism is, right? Back in the day, I know full well about absenteeism. I used to be not the greatest employee. But anyway, presenteeism is actually being at your job, at your desk, doing your thing, but you call in the pharmacist and you're calling the caregiver and you're making appointments and you're doing this and you're answering the phone at the bank and you're taking time off to run to the bank to go sign off on your father because he's back there again. So that was me. I was the poster child for presenteeism, right? I never forget being in a focus group with Darby at our old space on 95th. And we're doing this focus group and I get this call from my father at the time. We know what my mother is going through. And my father calls saying, hey, your mother just went to Evergreen Plaza. And I'm like, Evergreen Plaza? Evergreen Plaza has been closed for 30 years. And he's like, well, she just left out of here. And I'm like, you let her do that? And so I'm like, okay, I got to take him at his word. Maybe she did go up there to whatever it is. So I leave the focus group that's dealing with this issue, right? And I drive, and fortunately it's only 4 blocks away. I drive over to the mall. I'm in Carson's, which is the only store open in that mall now. And I'm showing pictures of my mother, like, have you seen this, right? It's like, they're like, no, but you know what? We'll call you, blah, 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 blah. And a little while later, she came home. My father walked out of the house and got 2 miles away from the house. And if you know anything about this disease, if someone walks away, the chances of them coming back are like this thin. And he had gotten like 2 miles away. And a man had the presence of mind to see him walking kind of aimlessly, talk to him. My father's a retired law enforcement person. So for him to be able to give up his wallet and see that bright green, lime green piece of paper with all our phone numbers on it and call my sister and say, hey, listen, I think I got your father here, right? And drove him back to our house. So don't tell me in the midst of what you're going through, God ain't still at work. So I say all that to say that, this work is, but for these wonderful people that are on this Zoom, that this journey is too much for one person to bear. And, we are expanding this because now we realize at the library, we were just one of the sectors, Tessa. We were just one of the sectors, something larger. And now we've, submitted application to be that community-friendly, dementia-friendly community, so that businesses and, I'll never forget, dropping off my mom and just waiting and giving her the opportunity to go in Walgreens and get her her favorite gum. And I'm watching at her, through the traffic, and I'm just looking at her, and it's taking like way too long. And I go in there, and the guy is like kind of real short with her, like, put your phone number in the, and because you have to do that at the at the point of purchase, and she couldn't remember her phone number. So this guy doesn't know from Adam that this person is suffering from dementia. And that was one of the things, at least the benefits of being at Woodson with Valita Simpson there now, our wonderful director, that their staff has been trained to at least recognize if someone is a bit wayward or if they're a little incoherent. We're aiming to hopefully one day get a social worker inside the library, a really novel, innovative way to approach this, because it's that dire in our community. And I remember in 2015, President Obama saying at a news conference, speaking to seniors, that for the foreseeable future, I believe every year, 10,000 people were going to turn 65. So imagine that. Imagine that. This is not going away. We need to be training a whole new generation and cohort on the art of caregiving for people who are going to be susceptible to this disease. And so I'll leave it right there. I think that's all that I wanted to share, but I'm so emboldened by this group, and we probably should have had 400 people. I know that's not probably allowable, but there are people that are not getting this information, and we will continue to work with our partners collaboratively to be that bridge so that people can take charge. Because the thing I remember the most was being somewhat in a fog. So before you start lavishing resources on people, people have to be able to process what is actually happening to their loved one and accept it, because it's a fog, and you can't go to a caregiver support group yet. You can't call someone at the Alzheimer's disease, association and talk to them, because you're still in a fog, because you've lost forever the person that you once knew. And I'm not talking about those lucid moments where they remember the gold watch they bought you in 8th grade. They're not coming back to that person. So, if you're young in that, it's part of the journey. Thank you so much, Dr. Miller, for giving me this platform. I know I went too long. I can see your head.
The journey that you talked about and some of the points that you brought out I think are just so very real. Number one, for our men that are in the audience, that sometimes you don't get the credit for the incredible work that you're doing as caregivers. We applaud you and salute you, because this is something that is really team play. Oftentimes men are action oriented and trying to get the job done, but also remembering that men need to take care of themselves as well as women in terms of caregivers. The ratio tends to be 2 to 1 in terms of women versus men, but I know that at least in my own family, that my brother has been an incredible caregiver for my parents when my parents were alive. And so his contributions are incredibly important. And then the issue of grief in terms of of accepting what's happening with your loved one, and being able to take the time and the space for that is important, as well as just the practical suggestion, the lime green paper in the wallet and having all of that information listed on there so that if someone happens to find your loved one, that they can at least contact you. There's lots of great information that's been going into the chat. And also there were some shout outs about presenteeism, which is something that I know is very, very real. Fortunately for many of us, there is Family Medical and Leave Act available in terms of being able to at least preserve your employment if you have to take on other caregiver responsibilities. And so making sure that that is in place for you, and having conversations with your manager, with your supervisor. We're all human. You would be, I think oftentimes if people are afraid of having those conversations, they would be surprised to find out how many of us have been impacted by having to care for loved ones in this way. I know in my own experience with this, and I again was living in another state, we ended up having to collect a team of family members in order to support. And I actually would work 4 days a week, and then I would fly in on Thursday nights and I would leave on Sunday nights so that I could be a caregiver during that time. And then I would go back to work in another city until I was able to figure out how to organize myself and eventually get myself back to Chicago. One of the messages that's coming through that we can see is that we are recording this session, and Natalie can share with you a little bit later how you can get access to it, because there's just so many rich pieces of resources that we have that have coming up in the chat. The conversation that we've had tonight, all of those things are there. And so I actually would like to see if there are questions or things that are coming up from people who are in the audience, or if you would like to add any questions to the chat, because we've got great people here who have resources, including Jeff. I know that you've been putting information into the chat box, but if you could just take a minute or two to introduce yourself and to say a couple of things about the Share Network, because I think that the information that you provide for us is so incredibly important.
Yeah, definitely. Thanks, Dorian. I'm Jeff Graupner. I am just one member of the Share Network. We got a small team, but we're small and mighty. We partner with a lot of community-based organizations. We're based out of University of Chicago, and we're all about getting resources into the hands of people who need them, specifically caregivers and older adults on the South Side. So yeah, there's links in the chat that you guys can check out. You can go to sharenetworkchicago.org to learn more about us. And we have a resource guide online, as well as a printed resource guide. We just published our 3rd edition, so it's totally free. If you are a resident service coordinator or something like that, we'd be happy to give you a box of 50 or more. So yeah, I'll write my email in the chat as well. Happy to continue the conversation. And thanks so much.
Thank you. Thank you. We are just about at the time for the time when we do our evaluation for the evening, but given that our audience has just gotten a little bit smaller, if we can probably take, Natalie, can we take one more question out loud before we go to the evaluation, perhaps?
That's fine.
Thank you. So anybody, if you want to raise your hand or if you just want to speak up.
May I say something?
Yes, please.
Well, thank you for having me here. I'm Robert Reed. I'm the victim advocate for Claretian Associates, which is located on the southeast side of Chicago. I service the South Chicago, South Shore, and South Daring areas. I'm 48 years old. My mother was terminally ill when I was 6 years old with cancer. I come from a 2-parent household that was disrupted by her cancer at 6. My 2 sisters who are closer to me in age, my youngest sister, Stephanie, and my middle sister, Cinnamon, were with us. However, because I was always close to my mother and my oldest sister, Sharon, who share the same name. I was her primary caregiver. Her and my father were going through different issues because of their own relationship. They were our parents. I was their child. I can't judge them for their relationship. However, I used to massage my mother's back because she was suffering from stage 4 breast cancer. From the age of 6 till the age of 8, she was suffering really bad. And at that age of 8, she passed away, unfortunately. And so I say all of that to say, at that age, my care for my mother and my love for my mother, what it did was it made me stronger as a person at 6 years old, because of the principles she was instilling in us. Like the scripture says, to whom much is given, much is required. She taught me history. She taught me about my family. She told me who I was. She told me what to do. She gave me an assignment. The first assignment that the Creator ever gave to a man, Adam, in the book of Genesis, is to keep the garden and to tend to it. So she taught me how to protect my little sisters. She taught me how to be respectful. She taught me how to talk. I'm ambidextrous because my mother was left-handed. One of my brothers is left-handed. My oldest brother, Reggie, is left-handed. And because I used to envy my brother, Reggie, I started writing with my left hand, although I'm naturally right-handed. And my oldest brother, Ronald, taught me how to play basketball at a young age. Unfortunately, I just fell victim to the streets because I didn't know how to process the emotion of losing my mother. I blamed God for many years. So I understand about being in a fall. I understand about grief, because I was struggling with it. And as a result, I turned to the streets at a young age because we were placed in DCFS. And although I got adopted by a family member, my aunt, and went through certain tragedies myself as a young child, and now the work that I do in service of domestic violence victims, the mentally ill, I would like to ask, because I deal with the elderly population as well. I have an elderly woman that stays in the city of Chicago on the Southeast side who is suffering from dementia. And her oldest sister is taking care of her. She's the youngest. And they're both elderly. I believe one is 74 and I believe one is 68, if I'm not sure. Her son takes care of her. And he could really benefit from these groups, as well as from any connection that you may have, because it's hard for them to understand, like her plight when she becomes flighty and just wants to get up and dress and leave because you remember one moment in her good old days. Because the woman was she's very beautiful. She reminds me of Lena Horne. And she still has those memories and those dreams. However, she doesn't have the physical or the mental capacity to maintain those dreams. They're just stuck in her head. So when she does something, she has set the house on fire.
Yeah. You know, Robert, the kinds of issues that you're raising and being able to make a connection with the community resources is the reason why we do these presentations. So one of the things that I would like to suggest is that Natalie is going to send out this information a little bit later so that everybody has the opportunity to have it. And because you do community outreach work, you will be able to share it with others. Natalie is going to put the poll up right now, but while she's doing that, and we're collecting the answers. Loretta, you've got your hand up, and I want to make sure that we caught your question because we need to start wrapping up. So if you could go ahead with your question or comment, please.
Yeah, I wanted to make a comment about the presenters that were talking about, first of all, about the veterans and Department of Aging. They didn't emphasize that there is a limited income or income that causes you not to be able to get the services free. You know, you may have to pay because you don't meet the guidelines for the income that they have. There's a limit on that. I'm aware of it because I had to take care of that for my husband. And if you make a certain amount more than that income limit, then you know you have to end up trying to get the services and pay out of your pocket.
Thank you. Very important point regarding making sure that you ask about cost issues in terms of getting services. Natalie, could you?
And one other thing I wanted to say on
go
the
ahead.
TAP program that was mentioned, they pay up to $30, and then after that you have to pay the $3 or start paying. So you get $30 at first, taken care of by them.
Important information. Thank you. Also, Amy Brennan dropped some information around into the chat regarding partnering with Illinois area agencies on aging and specialists. Christina Diaz, thank you so much for being on the call today and being able to listen. But Amy put her information in if you'd like to learn a little bit more about statewide support coalitions. Take a look at that. She's got a Gmail address in there. And Natalie, what are we doing on the questions? I see that we've got 15 people that have answered thus far. We're going to end the poll, and how soon?
We'll end the poll in a couple of seconds, and then I'll read the results.
Okay, thank you. Think maybe we can close the poll at this point. Thank you.
Okay, everyone should be able to see the results. First question is, I was aware of different types of memory loss before this seminar. It looks like many of you had some type of awareness around that. I was aware of resources, community resources around dementia. Somewhat aware, not aware is where most of you all fell. So I'm so glad that we were able to share these resources, and I'll make sure to get that information out to you. And then resources for caregivers, similar results, and we will make sure to get that information out to you. And then thank you. I'm so glad that this program was highly valuable. We will continue to produce these programs, for our community members. And it looks like that you would be very likely to join. We will be hosting another community grand rounds April 21st, which will be our youth summit, where our young people will be coming to talk about various health topics, and they will be teaching this information to their peers and having conversations very similar to those that we have been having. I will make sure that I share that information with you all. So if you have any young people, work with any groups that have young people, and it would be, if you think it'd be valuable to have them join, please share that information with them. I want to thank all of you all for joining tonight. We've had a great conversation, and I also saw the question about if I can share the recordings. I will do my best, try my best to get that over to you. We've had some issues around that, but I think we may have come up with a solution where we may be able to, we'll be able to get that done. Dorian, did you have anything? Dr. Miller?
Just a thank you to our wonderful guest for this evening. This has been a very rich conversation. Dr. Wendy Chen, Tessa Garcia McEwen, Kalita Bingley. Dr. Cheryl Woodson had to leave a little bit early this evening, but we thanked her, as well as Melvin Thompson. Again, thank you. Please come and see us again for our Youth Summit taking place on April 21st. And until then, everybody be well, stay healthy.